988. It could become the new National Suicide Prevention Hotline number. The FCC recommended the change earlier this month, citing the 11-digit length of the current number as just too difficult to remember.
This proposal comes at a time when suicide rates in America are at an all-time high. According to the CDC, there was a 33% increase in suicides between 1999 to 2017 alone. Nicole Berkins is a child psychologist, and she joins us now to discuss. Nicole, welcome to the show, and thank you so much for joining us today.
Thanks for having me. Important topic for sure.
Absolutely. Let's dive right in the interest of our visitors and viewers here. How would a 3-digit number help in the high number of suicides that we're seeing right now?
Well, you're right. This is rising at epidemic rates, the rate of suicide. It is the 10th leading cause of death overall, the second leading cause of death for children and teens. So an important issue. And, really the move to a 3-digit number addresses the fact that when we are in a moment of crisis, we are not thinking clearly, having to dial an 11-digit number, accessing that, trying to recall that or finding that, whether it's, the individual in crisis or it's a friend or family member who's with them. That's a really difficult thing to do and can prevent people from accessing the help that they need. So going to a 3-digit number makes that much simpler to remember in the moment. And the goal is then that more people will reach out to get the help that they need when they're in a crisis.
If someone does call that number, what do they encounter? Who picks up on the other end of the line?
Yeah, so the way that this happens now is when someone calls, it gets routed to a call center that is hopefully somewhere in the vicinity of where they are, and someone who has some training in how to provide support in that moment, how to ask appropriate questions to help keep the person safe, answers on the other end, and helps talk them, or if it's a family member, a friend who's calling, helps talk them through how to handle the situation in that moment, where they can access help, and really even just to provide some support and a listening ear to help provide some time, a moment there for the person to be able to think through a little bit more, what's happening, and to be able to access help instead of acting on, that hopelessness or that crisis feeling in the moment.
Nicole, I asked this next question from the standpoint of seeking edification. How effective is the hotline? How effective has it been in the past?
Well, it's a great question. And the research, we don't have a lot of research on it. The research has been somewhat mixed. Overall, we do find that it is helpful. It does reduce the number of suicides, people who act on that in the moment. What's less clear and where more research is needed is to really understand the specific types of help that we can offer on the other end of that call that really help in the longer term reduce suicide rates. So certainly it's an area where more research is needed to help us make it even more effective.
Anything else that you think would be important for the government to do, or any other steps that could help people who are considering committing suicide?
I think that the 3-digit number is a great first step. And what many of us are saying now is that what needs to come along with that is proper funding of the hotlines so that we can ensure that when people call this number, and the assumption is that there will be more people calling this number now because it is going to be easier to remember, that there are well-trained people on the other end responding to these calls. What we don't want to have happen is more people calling in and the phone ringing, not having appropriately staffed centers to answer the phone, or not having people who really have the best training to do that. So what we need to have is the 3-digit number, and then the funding to provide the personnel to properly respond to those calls and make sure that people are getting connected to the resources and the support that they need.
All right, Nicole Berkins, thank you so much for joining us today. Really appreciate your time.